Are you a vein specialist or vascular surgeon who has difficulty identifying reticular feeder veins? Me too, and we're not alone. It turns out it's actually quite a common problem that no one in the phlebology world is talking about. Some experts tell us that all we need is bright overhead lighting. That was the opinion expressed at the prestigious Venus Forum meeting in London earlier this year. But that's not my personal experience, and a recent poll I conducted suggests that many other vein experts find naked eye inspection alone unreliable. What is missing from current advice is an appreciation and understanding of how colour vision deficiency might affect our ability to see blue reticular veins. Those at the top on the luminary lecture circuit who publish guidelines and write books may have normal colour vision, but many others don't. And this is not a niche topic. Nearly 10% of men are affected and 1 in 200 women. In this video, I'm going to describe my own difficulty seeing blue feeder veins, how I overcame it for years, how I discovered the link with colour vision deficiency, and my personal experience of using colour vision correction glasses. So let's get started, and be sure to stay to the end where I will suggest how you can check your own colour vision and how to see if colour vision correction glasses might work for you. We all know that successful treatment of leg spider veins by microsclerotherapy requires identification and injection of the feeding reticular veins. I know this, you know this, but let's face it, in many cases reticular veins don't jump out. They don't jump out, for me at least. I have to hunt for them with a transillumination device such as the Veinlite. And over the years, I've made many instructional videos on the use of Veinlite. Many of my subscribers, many of the people who watch this channel, have found them useful. Now, some experts don't use transillumination, and they're rather disparaging about the use of Veinlite and other devices. Why is there such a division of opinion? Why is it that some vein experts simply use naked eye identification and others use all sorts of gadgets and gizmos? Turns out that one major reason might actually be congenital. Yes, that's right. It might be an inherited colour vision deficiency, commonly called colour blindness. Now, as healthcare professionals, we know about colour vision deficiency, don't we? And we know that red-green colour blindness is common. But what we as doctors, nurses and healthcare providers aren't always aware of is when it actually affects us. And even if we are aware that we are ourselves affected by a colour vision deficiency, the term colour blindness is a rather pejorative term. Who would want to be treated by a colour blind doctor or nurse? So, many healthcare professionals simply don't own up, or they may downplay the significance of having colour vision deficiency. Furthermore, we who have red-green colour deficient vision aren't always aware that this condition can affect our ability to see blue reticular veins. Who would know that a red-green colour blindness can affect seeing blue? Well, here's the thing. I made this discovery myself a few months ago on a hands-on microsclerotherapy course that I run with Miss Catherine McGuinness. Cathy is a board member of the British Association of Sclerotherapists, and she is the lead for training and standards in sclerotherapy. It was while Cathy was demonstrating the injection technique that a delegate took me aside and asked, "Is Cathy over-treating this patient?" It appeared to him that the blue veins she was injecting were very minor and couldn't possibly be of any major cosmetic concern. I have to say, I agreed with him. Yes, I could see some very minor veins, but to me as well, they certainly didn't seem to warrant injection. They didn't seem bad enough. And this started a conversation amongst all the delegates, the patients, Kathy and me. Imagine my surprise when the patient and several of the delegates confirmed to me that actually these veins were very noticeable and they certainly did warrant injection. This seemed to be more than just a difference of opinion and more than just a different value judgment. Maybe I and the other delegate weren't seeing the veins as vividly as the others, and more importantly, as vividly as the patient was seeing it. After all, it's the patient who's come to us to have these veins treated. Could it be that he and I both had a colour vision deficiency? Well, over the lunch break, I did a quick online Ishihara test on my phone. Yes, it confirmed my red-green colour vision deficiency. I knew that, and it confirmed the red-green colour deficiency in the other delegate that also thought the blue veins weren't severe. Could this be the reason for difficulty in seeing the blue veins? And by the way, the other delegate didn't know he had a colour vision deficiency. After that course, I bought some colour vision correction glasses. The result, yes, I can now easily see blue veins. And what's more, I could see others that I could easily miss without these spectacles. I have to say, I'm nothing short of amazed. As I say, I thought my vision for the colour blue was normal. Now, the glasses I bought were very inexpensive. There are lots of them on Amazon, for example. Just search for colour vision correction glasses. I suggest that if you're colourblind, you try a cheap pair like this before investing in some of the better quality brands, because colour correction glasses don't work for everybody. Now, at the beginning I said I would share with you how I tested my colour vision and the results of the correction glasses. This website is very easy to use. It does ask for your email address and you will probably get promotional material, but the results are sent to you by email and straight away. As you can see, this is my result with the naked eye and this is my result with the colour correction glasses. Here are the glasses I bought. As a spectacle wearer, I bought these clip-ons. Can I see the colours normally in the way that people with normal colour vision do? No, of course not. But can I see the differences in more colours? Yes, I can. In fact, because I can see more differences, my Ishihara test is now normal. I can see all the numbers on the Ishihara test, and although my test is normal, my colour vision is not. It never will be. But at least I can now see blue reticular veins. For me, it is truly amazing and transformational. For healthcare professionals, colour vision deficiency is a serious subject. I don't think it gets the attention it deserves from medical schools and hospitals, and many healthcare professionals are not aware that they're actually affected. In some situations, having a colour vision deficiency may actually put patients at risk. I've put links to some important publications in the description box. Now, although there are many publications on the subject, particularly in the medical literature, as far as I'm aware, no one in the phlebology world is talking about colour vision deficiency. Well, maybe they are now. If you're a healthcare professional, please consider taking the Ishihara test and leave me a comment below. I read all of these and I promise to get back to you as soon as I can. Thank you for watching, and please consider subscribing to my channel. That way you won't miss my next video.